I am Britten Williams, a senior student in Arkansas State University's Master of Nursing in Science Family Nurse Practitioner program. I will be presenting my quality improvement project, which compares colorectal cancer screening rates in rural Northeast Arkansas to that of the national average for the Create AState event. The title of this quality improvement project is Colorectal Cancer Screening Rates in Rural Northeast Arkansas versus the national average of 67%. My faculty mentor on this project is Dr. Christopher Jordan, who is one of my professors in the MSN program. This is my digital poster for the presentation of the project. The importance of colorectal cancer screening is that colorectal cancer is the second leading cause of cancer-related deaths in the United States, with an estimated 135,430 new diagnoses and 50,260 deaths in 2017. For the state of Arkansas, these figures were 1,582 and 595 respectively, with recent data from 2015. Colorectal cancer is a slowly evolving cancer which, through the recommended screenings by the United States Preventive Task Force, can be easily caught in the early stages and removed, decreasing morbidity and mortality from this disease. Screening may be completed through stool-based or direct visual tests such as flexible sigmoidoscopy, colonoscopy, and computed tomography colonography, with each different type having its own recommendation for intervals between screenings. The primary objective of this quality improvement project is to compare data involving colorectal screening rates in adults aged 50 to 75 in rural Northeast Arkansas to the national average, which is approximately 67%. The providers at the clinic can then use this data to determine how well their clinicians and patients are adhering to recommendations and make changes if needed. Data obtained for this project was obtained through a retrospective chart review with a randomized sample of 50 patients from the clinic's electronic medical record. Charts were reviewed through the clinic's compliance tracker for all patients between the ages of 50 and 75 for evaluation of compliance of colorectal cancer screening between January 1st, 2019 and November 18th, 2019. The findings from the data for this project indicated the rural Northeast Arkansas clinic had a colorectal screening rate of 58%. The national colorectal screening rate was 67%, and the rate for the state of Arkansas was 64.9%, meaning this clinic is falling behind both the national and state average. Colorectal cancer is the second leading cause of cancer-related deaths each year in the United States, accounting for 50,260 deaths nationwide in 2017. Given the slowly evolving nature of this cancer and the ability to easily remove the cancer most of the time with early diagnosis, increasing colorectal cancer screening compliance rates could have a great impact on decreasing the morbidity and mortality and the great burden of cost of treating this disease in the later stages. The rural clinic in northeast Arkansas in which the data for this project was retrieved colorectal cancer screening compliance rate of 58%, compared to 64.9% for the state of Arkansas and 67% for the nation. Increasing the colorectal cancer screening rate to above that of the national average could have a profound impact on improving the duration and quality of lives for many Arkansans. The results of this project will be shared with the clinic in an effort to highlight the low compliance rate compared to the state and national average, so they may discuss this information internally and hopefully devise a plan to increase colorectal cancer screening rates, leading to an increased quality of life for more Arkansans. This concludes the presentation of my quality improvement project. Thank you for taking the time to view it, and my hope is that you can take away some information from this project which can be used to improve the life of yourself, your family, or your patients in clinic.